Good evening. I see you're here for a cranial nerve exam. Can I please get your name and date of birth? Now, has there been any changes to your medical history? New medication? Increased dosage? Alright. And is your family doctor the same? Any changes in that? Okay. And now lastly, have you had any changes to your insurance, residency, emergency contact? Okay. Now, have you had any flu-like symptoms in the past 14 days? So any coughing, nausea, sneezing, sore throat, runny nose? Okay. And have you traveled outside the country in the past 14 days? Brilliant. All right. Please do remind me, have you been taking any heart medication, any blood pressure medication? Okay. So I'm just going to get a general read for your overall heart rate. I just want to make sure everything is looking good for that before we do move on. So just do you breathe like normal? Have you had any heart pain, heart palpitations, any stinging or tearing feelings in your chest? Okay. Perfect. Thank you for that. To begin with, we will be doing a general test for this. You didn't state previously that you had any major concerns with anything, so we will just be looking at the overall general cranial nerve exam. To begin with, I have this chart here. Together we will go through this and we will name off what each letter is for the selective line. We will start at the top. T, very good. Z, very good. Line 2. Perfect. That is P, T, O, C. For line 3. Yes, that was Z, L, P, O, D. Line 4. Brilliant. That was E, T, O, D, C, F. Do you want to try that one more time? It's a little bit more tricky now. Perfect. That was D, P, C, Z, L, F, T. Line 6. So that was C, F, D, T, E, O, P, L. Now for the bottom 2. If you get these, I'd be quite impressed. Okay, so the correct way was L, D, C, Z, O, T, E, P. And now for the very bottom. So that was P, F, C, D, T, Z, L, E. Yes. You did quite well for that little test. Although we don't expect you to get all of them right. It just gives us a general idea of your vision. Now moving on, we will quickly check your peripheral vision just to see how far and how wide it is. So I have these two sticks right here. I want you to focus just right on my nose right here and ignore anything else. I'll be moving these popsicle sticks just to out of your peripheral vision, just like this. I would like you to tell me when they exit and re-enter your vision. So just focus right on my nose. Okay. Very good. Next, I'm going to take a quick little look closer in your eyes. So I will be shining a very, very dim light just in your eyes as I am looking at it. I would like you just to remain quite still. Just look straight forward and look right at my nose again. Okay, perfect. Take a little bit of a look up here. Ignore the light. Let's see. Have you noticed any eye pain, any sensitivity in your eyes? Any blurriness, loss of vision? Okay. From your knowledge, has your vision decreased recently? Have you had any flare-ups, any dryness, any pain whatsoever? Alright. So I'm just going to be touching your face very lightly. I'm just going to take a bit of a closer look into your eyes. Although I don't see any major issues with my previous, more general look, I just want to look at the overall health of your eyes, see if there's any concerning veins in the overall sclera. Alright, hold still for me. I'm just going to pull your eyelid down just a little bit. Let's see. There's some minor redness. Nothing to be majorly concerned at. Do you use a sleep mask whatsoever? Any aids or tools to help you fall asleep? I'm just going to be pulling your one eyelid slightly up. Please bear with me. Okay. The other side. Okay. So there is some minor redness. Nothing to be alarmed at. I would just recommend using a daily or nightly eye drop just to help keep them moisturized to prevent further damage. Again, it's nothing to be worried about. I will be doing a quick little color blindness test here I have a few different colors I will be showing you. I would like you to tell me what colors they are, or at least what colors you can see. What color is this? Okay. What color is this? Blue, very good. What color is this? I would accept a gray or a dark beige. Yellow, correct. A dark brown, very good. And our last one, what color is this? Very good, thank you. I don't believe there's any major concerns or issues with your vision then. I will just take one last test just to ensure that your overall perception is quite good. This is a very simple test. I'll be moving just the popsicle stick again closer to your nose, just like this. I will be focusing on either eye. I just want to see just how your vision is going. It could be very revealing if you are cross-eyed or if you have a little bit of a weaker eye. Afterwards, we will have a very similar test that we will do. So just look at that popsicle stick as it gets closer to you. Okay, focus on the tip of the popsicle stick. Okay, very good. And now for our last little eye test, I just want you to tell me which hand is getting closer to you and which one is getting further away. So let's make sure that your overall depth perception is quite good, similar to the previous test we were doing. So just tell me if it's the left side or the right side. Okay, perfect. Okay, perfect. Overall, I don't believe there's any issues with your overall vision. It does seem like your eyes are quite healthy, both in the actual physical sense and actual seeing sense. Perfect. We will quickly move on to your ears just to ensure everything is working in there. Now, before we look into it, now in regards to your ears, have you had any ringing sounds, major sense of pain? Okay. I'll ask you to look over here for me. I'm going to take a little bit of a look inside of your ears. Please hold still. Do you notice that you have pains at all, earaches whatsoever? Any difficulties hearing? Feeling a little bit stuffed or clogged? Okay. I am noticing a large earwax buildup. How often do you clean your ears? Using a Q-tip, using an ear cleaner? Okay. We do like to see it after each ideally after each shower you take, just to do the outer of the ear. The more you stick a Q-tip inside the ear, the higher risk it is for damage. So we don't always recommend that. Just to protect the middle ear. The outer ear is more forgiving in that sense. Alright, so we will be doing a couple little hearing tests. The first one, I would like you to close your eyes for me. Just keep your eyes closed. Don't have them open. Close your eyes. So for this test, I have these, say, beads in this plastic jar, in this container, and I will be very lightly just turning them over like this around your head. I want you to tell me if it is on your left side, like this, or if it is on your right side. Okay. So remember, keep your eyes closed during this whole little test. Do not have them open. Very good. Now, is it on the left side or the right side? Very good. Now, in a very similar sense, with your eyes remained closed, I have this little snipping tool. Please tell me how many times you hear it on each side. So, for example, I'll say left side. And you could hear it 5 times. Okay. So we'll start on the right side. Very, very good. Perfect. You can open your eyes up again. Thank you. It doesn't seem like you're having any delays or issues with that in hearing. Have you had any issues of hearing anything muffled, any sensitivity to loud sounds or very quiet sounds? Okay. nothing to worry about. I will take one quick last look back into your ears, just to ensure that there's no issues with that. We'll be using a UV light for that, just to check for any infections or any things that aren't exactly supposed to be there. Okay, so just hold still for me. Let's see. Let's get you to look over here for me. Okay, your left ear first. Let's see. I do recommend that if you do go swimming or go into open bodies of water for a prolonged period of time, you should try to use a Q-tip just to remove excess water. This side. Just to prevent an increase in possibilities for infections and whatnot. We too tend to see, especially in the warmer months, as people are more open to going swimming, either on the beaches and pools or some lakes and whatnot, there is an increase in ear infections or ears getting clogged with water, which then cause a bit of a bacteria buildup. Hence, we do like to put that reminder out there. Although I don't believe there's any issues or concerns at the immediate moment. Perfect. Now, have you had any overall sensitivities or pains in the sense of someone touching you, brushing up against something? Okay. So for this next test and next little section, I will be looking at the overall sensitivity and irritation and overall the sense of touch. So to begin with, I'm going to be just feeling your face, your neck, and your shoulders. Just looking for any increased lymph nodes, any bumps or lumps that aren't expected to be there. Alright. So please do hold still for me. Have you noticed any increase in your lymph nodes, any irritation? Typically, your lymph nodes will come out and be more prevalent when you're sick or fighting something, just to help get rid of the virus or infection. However, if there is a prolonged amount of them or they are prevalent longer than expected, that is reason for concern that we do like to look into. So I'm just feeling around your head. I don't feel any immediate lymph nodes. Okay. So you look up for me. I'm just going to feel into your jaw here. Just around your neck, down to your shoulders. Have you had any unexpected sharp pains, any irritation? Any overall sensitivity to stuff like the sun, to certain fabrics and whatnot? Okay, I see. So we're just going to do a quick little test to see how sensitive your skin is. So I have this feather right here. I will very lightly be tracing it along your face. I would like you to keep your eyes closed for me. And just tell me when you feel the feather touching you. It's more just if you notice the sensation of it touching you. Sometimes people have a bit of a thicker skin and overall first layer of the skin. Hence, they may not be able to immediately notice the tracing of the feather. Okay, so please close your eyes for me. Keep them shut all the way. So again, please tell me when you feel the feather tracing along your face. Okay, perfect. Now, are any of those sensations painful? I see. Would you say they irritated you in any sense? Or are they difficult to notice? Okay. So next we will be doing a little bit of a soft or sharp test. Say soft or dull. It's not really that sharp. So I have this little tool here. This is a hair clip that I'll be very lightly just pressing down on you. It is very dull, something that you should be able to notice. And then for the soft section, I have this little brush right here. I will be brushing against your face. It could be a brush motion. It could be just me lightly pressing down on it. Okay. So again, if your eyes closed, please tell me, is it dull or soft? Okay, perfect. You can open your eyes again for me. And now, during any of that, have you experienced any painful sensations from it? In some rare cases, we do see that people tend to take the soft feeling as something a little bit sharp or painful. While after a prolonged exposure to the dull object, they may find it soft or something that isn't exactly dull. Okay, let's add that to your file. Okay, now in a very similar sense, I have this very cool fabric right here. This is a fabric which holds on to the coolness. It's not very absorbent of the heat. So I will be very lightly tracing this cloth on your face. I just want you to tell me if you notice a cold sensation, if you notice anything that's painful or sharp or whatnot. Okay. Please hold still for me. Alright. Perfect. I don't believe you have any issues in the sense of touch or sensitivity or any painful sensations. However, we will be moving on to your sense of balance, sense of this kind of direction in a way. So for this, I will be very lightly pushing your head to the left side or to the right side. I want you to try to keep it straight, keep it balanced. Do not allow me to move it. Okay, hold it still for me. I'm going to try to pull you to the left. Good. The same way, I'm going to try to pull you to the right. Do not allow me to. Okay. Back to the left. Okay. In a similar sense, I will be pushing your head up and I will be pulling your head down to allow me to try to keep it straight, keep it even. Okay. Let me try pushing your head up. Do not let me do. Okay. Do not let me pull your head down. Very good. Now please put your arms out straight. Just keep them straight, very horizontal. I will be similar to what I was doing to your head. I will be trying pushing it up and pulling your arms down. Do not allow me to keep your arms straight and steady. Very good. Have you noticed any weakness in your muscles? Any overall sensitivity or difficulty of lifting stuff? Okay, I'm pushing down now. We do tend to see a increase in your muscles degrading. Just as you do age, it is something that does happen as you get older. We highly recommend being active, trying to exercise as much as possible. Are you an active person, or would you consider yourself active? Okay. Do you actively lift weights? Do any running, walking often? Okay. Please put your hands out straight like this. I'm just going to be feeling around your muscles and joints. Many studies have shown that individuals who do leave, many studies have shown that individuals who live a more sedentary life don't tend to be as healthy, of course. This can cause issues with their muscles and joints. Just try to keep the body moving as much as possible. Have you noticed any signs of arthritis, any pain or sensation in your wrist, hands, or fingers? We do tend to see it more so in the bottom section here, a bit more common. Of course. Are you in front of a computer quite often, typing, sending emails? Or doing like repetitive tasks with your hands, using a hammer or whatnot? We just do recommend that you are mindful of that just in case, as we don't want any early onset arthritis to begin. Perfect. And now, have you had any joint pain in your fingers whatsoever? Okay. So I will be very lightly just cracking your knuckles, cracking your fingers. We're just seeing if there is any your air pockets and whatnot. going to add that down to your file. I don't see any major concerns in overall your muscle and balance sense. Do you get dizzy often? Okay. Perfect. And now, have you noticed any issues with your sense of taste, your taste buds, having any issues with your mouth? When was the last time you visited a dentist? Okay. So although we are not a dental clinic here, we will still take a quick general look at your teeth, see if your gums are receding in any way. So I'll ask you to open your mouth very wide for me. Take a quick little look. And now, how many times do you tend to brush your teeth? Do you floss at all? Do you use mouthwash or a water pick? And now, have you noticed any pain, sensitivity, issues of your teeth or gums in any way? Okay. That seems fine. I'm just going to lightly put my thumbs on the inner side of your cheek just to feel how your overall thickness of the skin is. Just gonna feel around in your mouth. Just try to keep your jaw straight. I'm kind of feeling for the overall structure of everything, making sure there's no issues in there. Just keep your mouth open. I'm just gonna feel around here. Sometimes we do tend to see like small cuts, small divots and whatnot, just on the inner flesh of the cheek, which is some minor concerns. Do you wear a night guard at all? Okay. Now, have you had any issues with your sense of taste? Have you noticed any taste buds changing? Any foods that you normally eat tasting a bit off or not able to palate or stomach it? Okay. So now we do have a few liquids here. These are all scented and infused with different flavors. This will kind of include the sense of smell as well. I would like you to tell me what you smell, if there's any distinct or noticeable scent, and taste when you consume this. Take a big smell. What do you smell? Okay. And now take just a small sip. Tell me if the flavor is a bit different. Now, what did that taste like to you? Okay. Take a smell. What does it smell like? And let's take a little bit of a sip. And what does that resemble? Peppermint, very good. We have two more. Have you noticed any discrepancies with your scent of taste, to your sense of smell. Take one more big breath in. What does that smell like to you? Okay, very good. Now take a quick little sip. Brilliant. Now you have gotten those 3 spot on. So I don't believe there is any issues in your sense of taste or sense of smell. However, I will take a quick little look just at the back of your throat, and then I also take a look just up your nose. I just want to make sure there's no issues with the overall membranes or cartilage in them. Okay, so we'll start with the back of your throat. Please open up. I just want to look for any redness, although overall the taste seems quite fine. There may be some minor redness at the back of your throat, irritation, or problems in that regard. Perfect. There's no redness. That's quite positive. And now for your sense of smell, have you noticed a decrease in overall cartilage? Any issues with the inside of your nose? Often nosebleeds? Okay. So I'm just going to take a quick little look. Just in your nose right here. Just tilt your head back a little bit. Okay. Just going to look up here. Do you get quite, say, clogged up or stuffed up when it is summer? Any seasonal allergies? Okay. That is something that is quite common among people. Be grass, pollen, or whatnot. There's a common allergy or issue between individuals. Although overall it does seem like your sense of smell and the overall structure of your nose is quite fine. It doesn't seem like you have any issues with your sense of hearing, sense of taste, overall feeling and sensation. Same with your overall sense of I don't believe there's any issues with that. But for our last little test, we will do a little bit of like a memory test. We have seen an increase in the decline of short-term memory lately. While it is quite difficult to test long-term memory in a session like this, short-term memory is something that we could address quite easily. So we'll be doing a little bit of a game. I have a standard playing deck here. In here we have everything from 3 of diamonds to the king of spades and whatnot. I will be showing you a multitude of different cards. I would like you to tell me what the suit is, what the number is, and whatnot. So I'll hold up a card, for example. Please tell me what the suit and number is. The 8 of Hearts, very good. And same for this card. The 9 of Spades, perfect. And that was quite unlucky. Forgot to take the Joker cards out. My apologies for that. 9 of Diamonds. Queen of Diamonds. And Ace of Diamonds. So now I'd like you to tell me what the second card you saw was. including the Joker card. So that should be the 9 of spades. Perfect. So we will be doing a test very similar to that. I'll be holding up a multitude of cards. I might ask you what the suit is, what number the 5th card was, what was the highest card, what was the highest rank, and whatnot. Perfect. So I will shuffle those back in. If we do get quite unlucky and get the Joker card again, I'll skip that and remove that. Okay. Almost back to back. Okay. And 2 more cards. Okay. What were the 2 cards which were not diamonds? Okay. Not too far off. We have the 3 of spades, which is the last card we saw. And the 5 of clubs. We'll do that one more time. What was the lowest valued card? So that was the 4 of hearts. So now we'll be doing a little bit of a different game. This is more testing how quick you can think and remember things. Think of it kind of like war. So I'll be holding up 2 cards, either on the left or right side. For example, we have a Jack of spades, and we have a 10 of clubs. In this case, I want you to tell me which one has the higher value. So that'll be the left-hand side. We'll be doing this at a bit of a quicker speed. So I would like you to tell me in 3, 2, 1, which one is higher. Very good. And in 3, 2, 1, which hand is higher? Very good. 3, 2, 1. Perfect. 3, 2, 1. 3, 2, 1. And one last time. 3, 2, 1. Okay. Now in this sense, I just want to see how your brain connects stuff, such as, is there any similarities in the cards? So again, similar to the last round, I will be holding up 2 different cards. However, I would like you to tell me if there's any similarity, such as, are they the same suit? Are they connecting numbers, like a 2 and a 3, or if it's like a 3 and a 4? Are they a face card, or are they any similarities in that sense. So again, I would like you just to tell me and let me know if there are any similarities. If there's any personal similarities that you notice, that can work as well. Okay. So I will count down one more time. 3, 2, 1. Tell me any similarities. Okay. 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. Okay. And now just before our next little memory test, I would like you to remember the number 5339. Thank you. Alright, for our next little game, very similar to what we were doing before, I will be holding up 2 different cards. I want you to remember what each of them are. In this sense, we have the 7 of clubs, and we have the King of spades. Afterwards, I'll be showing you 2 different cards, such as the 8 of diamonds and the Jack of clubs. After this, I may ask you if the King of spades was in my left or right hand. Or I might ask, what was the red suit, which was the 8 of diamonds. I'll be asking you very similar questions like that, just adding more variation. Okay. So you have 2 cards here. Okay. Now, what was the second card in my left hand? Yes. The correct answer is the Ace of Heart. All right. Now, what was the suit and the number of the only black card I held up? Now, the correct answer was the 10 of spades. Let's do this a couple more times and we'll be all good to move on. Okay. Now, what was the card in my hand, my left hand, on the second round? That was the Ace of diamonds. Let's do this one last time. Now, what was the lowest valued card? Yes, that was the Jack of Hearts. Very good. And now, do you happen to remember that number I asked you to recall? Mm-hmm. Okay. Yes. That's very good. Now, it doesn't seem like you have any major issues with your short-term memory. Of course, if you want to go into a more of a long-term memory sense, we can book a separate appointment for that and go a little bit more in depth for that. As I mentioned before, for a more direct and general appointment is a little bit difficult to get into. Overall, I don't believe there's any issues if you're hearing, sense of smell, sense of taste, overall vision. Your balance seemed quite fine. I didn't have any issues with your sensations of your sensitivity, and I didn't feel any issues or any lumps or bumps on you. Overall, I feel like this is quite good. If you have any further questions, concerns, or worries about your general health, overall hearing, vision, or whatnot, of course, we do recommend going to a specialist for that. We mainly do a general test, to see of everything. Perfect. Well, again, if you want to come back in, I'd recommend just a couple of months. Again, you can always consult with your family doctor, or say a dentist if you have any issues with your teeth. You can do an optometrist if you have any issues with your eyes. However, if you do want to come back and see us, you're more than welcome to. Okay. Well, again, it was very lovely to have you in. I have everything updated on your file here, just of the information regarding your symptoms, how you were handled, and all that. If you want to book a following up, you can head out to the front, and a receptionist will be able to help you with that. Perfect. Well, again, it was lovely to see you in, and I hope to see you again soon. Okay, bye-bye now. I hope you have a lovely night and a lovely sleep.